Hi there, and welcome to Asthma, Allergies, and Naturopathic Medicine. I'm Dr. Joanne Yanez. I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges, and super excited to have you all with us here today. So before we get started, I just want to go through a little bit of housekeeping. Glad to see you all here. So there is the chat box, which I see a couple of you using, but for any questions during the webinar, please use the Q&A function, which is the Q&A box down below. You are all, as you can tell, probably in listen only mode. We are recording today, so we'll share this link when it's ready. It's also all of our old webinars are up on our website as well. If you have any questions afterwards, or you have any issues, please email us at info@aanmc.org. And with that, I am going to introduce our speaker for the day. So with me today is Dr. Amanda Bose. She is the Chief Clinician of Naturopathic Medicine at the National University of Health Sciences. She's a family practitioner who's much experienced in treating a wide array of conditions and patient populations. She strives to bring her patients back to a state of health, getting to the root cause of their problems, and using evidence-based natural therapies. And so with that, I'm going to turn it over to Dr. Bose. Super excited. Thank you so much for joining us today, and make my video go away so you don't see me sitting here while you're talking. So thank you, Dr. Bose.
Thank you, Dr. Yanez, and thank you for everyone for attending. A little bit of my background besides what Dr. Yanez has already said. I'm originally from Maryland, and Marylanders are quite proud to be from Maryland, so I thought I'd mention it. I attended the University of Maryland and have a Bachelor's of Science in Kinesiology, and I was originally interested in chiropractic medicine because I had a nice career in gymnastics and of course experienced some injuries from that. So I did go to the National University of Health Sciences Florida site for the chiropractic degree, and graduated with that degree in 2014. But during my time there, they only have the chiropractic degree down in Florida. However, they have classes that are integrated between Lombard and Illinois and Florida. So I did have some contact with the naturopathic medicine students and found that I had an interest in treating more chronic disease related to lifestyle. And so then I obtained the naturopathic doctorate degree. And since they only have that in Lombard, I moved up to Illinois for that, and officially graduated in 2015. And then I became the chief clinician of the naturopathic medicine program at NUHS in 2017. And so I'm here doing that with a great crew of clinicians. And really what a chief clinician does is that they oversee the naturopathic medicine clinic, work with interns in their last year of training, so that they can develop the skills to become wonderful naturopathic doctors themselves. So today we'll be covering the background on asthma and allergies, how to diagnose asthma and allergies, naturopathic approaches to asthma and allergies, and then we'll go over a nice patient case. So we'll start here with allergies. An allergy is when the immune system reacts to a foreign substance, and that foreign substance is called an allergen. This reaction can cause symptoms like coughing, sneezing, itchy eyes, runny nose, scratchy throat. Sometimes patients can also have rashes or hives, changes in their blood pressure, asthma attacks, and if that allergy is severe enough, it can even cause death. So quite serious. An allergen could be anything that you eat, you could breathe in, or inject into your body, even touching. Sometimes if you touch something that you're allergic to, you'll get a rash. With asthma, that is when your airways swell and it causes difficulty of air being able to flow through your nose and mouth all the way down to your lungs. Allergens are a common trigger for asthma. So this could be anything from mold, pollen, pet dander, other airborne particles. And symptoms include trouble breathing, wheezing, coughing, and tightness in the chest. If you do experience an asthma attack and do not get help right away, or don't have like a rescue inhaler on hand, this can also lead to death from constriction of the airways and air not being able to get to your lungs. So how do we diagnose either allergies or asthma? Naturopathic doctors are really known for their detailed medical history taking skills. So we ask many questions to gain a detailed understanding of the patient's symptoms and what can be the root cause. We first start with what is going on with the history of present illness. So right now, any past history of this condition, as well as other conditions. Family history. Does anyone else in your family have this? A lot of times you will see that allergies and asthma do run in families. Lifestyle. We take a history on anything from dietary habits, stressors, what the air quality is like if you grew up in a polluted area of the country or the world, or if you have HEPA filters in your house or nice cleansing plants in your home, what medications you may already be taking, and any environmental exposures. So environmental exposures are typically what kind of pollens are in the air, if there's any history of mold in the home that you're living in, or water damage that can lead to mold. And then we move on to a physical exam. So the physical exam depends on what came up in the history. Things that can be performed are the ears, eyes, nose, throat exams. Always checking the lungs just to make sure that any congestion that is in the upper respiratory tract hasn't come down to the lower respiratory tract. And then listening to the heart too. A lot of times the respiratory tract and the heart, they go hand in hand. We can also do lung function tests to determine how well a patient exhales. Chest x-rays can be indicated, again, to make sure that there's no lung pathology that you see in the structure of the lungs. Another common test is a blood test called the IgE, IgG, food sensitivity testing. This is a blood test that looks at both two different parts of the immune system. So your IgG is going to be more of a delayed response to an allergen. So sometimes you could eat something or touch something and have a rash maybe a day or two later, or extreme fatigue a day or two later. So that would be the IgG subtype. And the IgE is more of a immediate reaction. So you'll hear of people eating something and their mouth itching, or they get hives right away, their face swells, or sometimes they'll get that swelling of the airways that would be more of that asthma picture. So once you've arrived at the diagnosis of either allergies or asthma, we would want to start by working with what's called the determinants of health. The determinants of health are all lifestyle factors that are going to be the basis of a treatment plan, going from the least invasive therapeutic to the highest invasive. So the highest would be like surgery or medications, things like that. So ensuring clean air is very important for anyone with asthma or allergies. So this includes removing triggers from your home or other places that you spend a lot of time, like the workplace. So making sure to eliminate dust. At home, this could include like washing your sheets at least weekly. Cleaning, using HEPA filters within the home or workplace is helpful with dust. examining your home for molds, especially if there is a known water leak or water damage that has occurred, and ensuring a smoke-free environment. So any kind of smoke, whether that be from cigarettes or cannabis, can irritate the airways and the sinuses, nose, mouth, throat area. Dietary modifications are also important. So eliminating food allergies or intolerances that either came up on testing or that came up within the history. Common food allergies or intolerances will be like mucus producing foods, like dairy. Bananas are a mucus producing food. So the more mucus you have, the more symptoms of like congestion, runny nose that are going to be associated with your allergies or asthma. Overall, we want to reduce the inflammatory load. This is pretty much true in any type of patient, but ensuring that we're eating a whole foods diet high in vegetables, fruits, and omega-3s. Basically, the foods that you put in your body, they break down into chemicals, and those can either be pro-inflammatory and cause more symptoms, or anti-inflammatory and cause less symptoms. So the more anti-inflammatory we can be, the better. And vegetables, fruits, and foods high in omega-3s are always going to be anti-inflammatory. Other approaches, always treating the gut. So a lot of your immune system is found within your gastrointestinal tract. And when we modulate the immune system, this can lessen allergy and asthma symptoms. Also, inflammation of the gut can cause permeability, which creates a vicious cycle of both the IgG and IgE food reactions and can predispose the development of food allergies and intolerances. So things I like to use to treat the gut are first working with diet, but probiotics are a great way to start to balance the microbiome that's within your large intestine. Fish oil, vitamin D, both of those help build up the mucosa layer of your gastrointestinal tract. Turmeric or curcumin, this is an anti-inflammatory gut healing herb that's wonderful either by putting it in your food or taking a highly absorbable supplement. And L-glutamine and zinc really help just the cells of the gastrointestinal lining to heal. Also, stabilization of mast cells. Mast cells are a white blood cell in your immune system that secrete histamine. And histamine is what causes that allergic symptom picture. So when you are exposed to an allergen, your mast cells secrete histamine and can cause things like hives or congestion, rashes. So we like to use mast cell stabilizers to prevent the release of histamine and reduce allergic reactions. I love using high-dose vitamin C with bioflavonoids as a mast cell stabilizer. Quercetin and EGCG, which is a green tea extract, are also great at stabilizing mast cells. Medications are one of the higher level interventions that we can use for patients. So typically, long-term control is something that you would take daily for control of asthma and allergies. We can use corticosteroid inhalers, leukotriene modifiers, like montelukast is one of those, or decongestants and antihistamines. Antihistamines are things like Benadryl or your Sudafeds for decongestants. Other times we may experience a acute situation where we need quick relief. And these types of medications act really fast to relax the muscles in the airways so you can breathe appropriately. These should not be taken more than 2 days a week. And if you find that you are taking them more than 2 days a week, you should consult with a doctor to look at your medications. So these are going to be like those rescue inhalers. All right, this is a patient case of someone that was seen within National University's Health Sciences Student Clinic. So I'll read through this with you. It's a 41-year-old male who presented with nasal congestion, sinus pain, and cough of 20 years duration. And these complaints started while the patient was in college. He had no identified triggers. He would take Sudafed to clear up his symptoms right away. However, after college, medications really stopped working for him, so he discontinued them. He reports constant nasal congestion with discharge and is unable to breathe through both nostrils. Furthermore, he describes his cough as dry and persistent. The cough worsens while he is speaking and while there is a change in temperature, for instance, walking from inside to outside environments, especially like in the winter when it's warm in the building and you go outside and it's colder. He noticed improvements with cough when consuming alcohol and eating Altoids. He also had a history of exercise-induced asthma. So sometimes it's not just like allergens or outside influences that can cause asthma, but exercise-induced can contribute as well. He has a history of asbestos exposure from working construction jobs throughout college. So that's one of those environmental exposures that we would want to look more closely at. For social history, he's a non-smoker. He denies alcohol consumption, even though he said that he noticed that it made it better at times. He has a large amount of caffeine consumption, so he drinks 240 ounces of black tea daily. And we did a 24-hour diet recall, so asking a patient everything that they ate within the last day to get a good picture of what they eat. Sometimes you can also send them home with, well, a lot of times we send patients home with a 7-day diary so that they can record and you can get an even broader picture of what their dietary habits are like. So for breakfast, they had 3 eggs over easy, sourdough toast with butter, a half a palm size of dried mango. Lunch, they had 8-ounce steak with side of mixed vegetables, Brussels sprouts, bacon, which was described as typical. However, the day before, they had a peanut butter sandwich instead of steak. For dinner, they had 3 medium slices of pizza with stuffed crust and meat lovers, a handful of blueberries. So, there are some good things here. He is eating, some fruits, a little bit of vegetables. However, there was quite a bit of processed foods at this lunch and dinner. We did do a physical exam. We looked at the sinuses, did an ear, nose, throat exam, looked at the mouth and the gums. We felt for any lymph nodes, if there was any infection going on. You may have lymph nodes. Listened to the lungs and heart, and we did an abdominal exam too. So the only thing that was positive on this exam was tenderness of the frontal and paranasal sinuses when you were feeling. There was also mucoid discharge and redness or erythema observed upon the nasal examination. We also decided to do a chest x-ray because of the asbestos exposure in the past. We just wanted to make sure that there wasn't any damage to the lungs from that exposure. And it was clear, so no structural abnormalities of the lungs, which is great news. So our treatment plan consisted of first the anti-inflammatory diet. Again, the anti-inflammatory diet is really based around a plant-based diet. You can have meat with this diet, but focusing on getting at least half or 75% of your plate to be fruits and vegetables, and then that other quarter can be fish, organic chicken, grass-fed beef if they want to eat meat. We recommended reduced caffeine intake. 240 ounces of caffeine is, I've never had a patient drinking that much caffeine prior to this patient. So, when we did bring up how excessive the caffeine intake was, the patient was under the impression that because it's black tea, that it was healthy for him and he could have as much of it as he wanted. So we did suggest trying to drink more water instead without caffeine. And we did find through our research that caffeine can also increase mucus production. And the mechanism of that is your body becomes dehydrated from caffeine. And so then you develop more thick mucus. And thick mucus is harder for you to clear out of your lungs or your nose and throat area. We recommended vitamin C with bioflavonoids. This was a powder that he could put in water, so get some more water intake as well with that. We formulated a botanical tincture. So these are the Latin names for thyme, Echinacea, rosemary, eyebright, and coltsfoot. So thyme is anti-inflammatory. It acts as anti-mucus production. Echinacea supports your immune system. It also has some antimicrobial properties in case he did have an ongoing sinus infection. Rosemary is highly anti-inflammatory, so we'll work with that immune reaction. And then coltsfoot and eyebright act as decongestants. They also help dilate the airways. So instead of constricting, we're doing the opposite and dilating. We also recommended a homeopathic remedy, Nux vomica 30C. And homeopathic remedies are based around keynotes or things that are specific to the patient that really stand out. Some of those keynotes are needing high levels of caffeine. This patient was also a workaholic, somebody who gets irritable very often. So those are all keynotes of Nux vomica. So that was all on his initial treatment plan. And he was very compliant with the caffeine reduction. We were worried that he wouldn't be, but he followed through. And he also took all the supplement recommendations and botanical recommendations. And he noticed improvement within 3 days of initiating the treatment plan. After 1 month, there was 80 to 100% reduction in his nasal congestion, sinus pain, and cough. So this person also, when they were speaking, it was almost, how people clear their throat very often. He would cough between every sentence, and we noticed on just follow-up that he wasn't doing that as often. And this is, that symptom reduction is self-reported from him. He was able to discontinue the supplementation with continued reduction in caffeine consumption. So he still does drink some black tea, maybe 1 to 2 cups a day, but the rest is water. And I thought this case was just really interesting because it was something that was, glaringly obvious through just history taking that maybe something that is contributing to allergies for this patient. So what I love about naturopathic medicine and advice for students, I love just getting to the root cause of a patient's symptoms and using low force natural therapies to improve health and well-being. So working with somebody's diet, stress reduction, simple things. Exercise is always great too. Simple things that can be overlooked a lot of times in healthcare to help patients get better and live healthier lives. I also love how you can really individualize a treatment plan, and there's so many options within a naturopathic doctor's toolbox. There's no two naturopathic doctors that really practice alike because of the way we have so many options. So you can either choose to be more low force intervention with natural therapies like I do, or you can even prescribe medications or perform minor surgeries depending on the state that you're in. And my advice for students is to really concentrate on knowing your basic sciences. There is more evolving research in naturopathic medicine or naturopathic therapeutics. However, sometimes the information is not there. So if you can go back to biochemistry and biology and rationalize the mechanism of action, that's a great way for you to be more still evidence-based without having full-blown clinical trials at your hands. And you can always build your skill set once you have that foundation in place. So the foundation is important. And my future plans. I plan to continue as the chief clinician of naturopathic medicine at National University of Health Sciences. I also see my own patients here, and I love what I do. So I hope I see you here one day, or at a conference or something. So continuing to do what I'm doing. Prospective students, if you know this is something that you want to do, I would, get more information, find out, what school is going to be best for you to go to, and just get started and grow your skills. So that's what I have for now. Dr. Yanez?
Yes, wonderful. Thank you so much.
Mm-hmm.
So before we get started on the next question and answer section, just want to let folks know about the next upcoming 2 events. So we've got Naturopathic Oncology next month with Dr. V, and we have finance. We've got 4 students joining us in July for how they have been paying for their naturopathic degree in interesting and unique ways. And so I'm really excited about these up and coming events. And then the next slide real quickly. And so if you want to reach Dr. Bose, here's her contact information. And to reach AANMC, the info@aanmc.org email is a great way to reach out to us or through our website. So with that, we're going to get started on a few questions. So for people who may not have asthma medication nearby or around or available, I know there have been a number of natural remedies bandied about in the past that I remember learning. Are there any that you recommend? I know one person asked specifically about cabbage, but are there any for folks? Obviously, asthma is a very serious condition, and you talked about the need for appropriate assessment and diagnosis and management because it can go south pretty quickly. But let's say somebody forgot their inhaler, or they're not near close enough to it. What are some things that you would recommend?
I still recommend, getting to anywhere that has a rescue inhaler as quick as possible, whether that be a, minute clinic or going to the hospital. If you don't have that rescue inhaler, you know, uh, sometimes you can do some like breathing techniques to help in the meantime, but usually it's not going to reverse itself as with natural medicine as quickly as it would with medication. So, one thing I also like about naturopathic medicine is it doesn't have to be all natural. You can co-manage and work with medications to really have a well-rounded treatment plan for someone.
Yep. Thank you.
Mhm.
Yeah, I know that there's also been a little bit of literature with magnesium because of the relaxation with smooth muscle. Uh, Too much magnesium will also relax the muscles in your bowel. So you do need to be careful with magnesium dosing. And a very strong dose of caffeine in some cases can also help alleviate, although with your patient that you presented earlier, probably not so much. But there are a few things that do have a little bit of literature behind them with that. But I'm not familiar with cabbage broth, so sorry about that one. Uh, there was a question here about echinacea and if you know of any complications with folks with ragweed allergies.
Um, I haven't had any problems with giving echinacea for ragweed. One thing that you would want to watch out for is people with autoimmune conditions, and there are other herbs that may be better for a patient with autoimmunity rather than echinacea. Um, However, with ragweed, that's a common allergen for a lot of people, and I've had much success with echinacea and ragweed allergens.
Thank you. There's a question here about NAC. There's been some recent uh, issues potentially with getting NAC. And so are there other ways that you recommend boosting glutathione other than NAC?
So vitamin C and vitamin E also help cycle glutathione. You can always, I haven't had any problems with sourcing NAC right now. Um, you could also just go with a liposomal glutathione instead of an NAC.
So there's a question here about testing, and I know you talked a bit about IgG and IgE allergy tests. Uh, I'm wondering if you can touch on how you differentiate between food allergy panels, elimination diets, and running IgG, running the blood tests.
Great. So I'm a practitioner who likes to eliminate common allergens first and make dietary changes first before doing this testing, unless someone is very adamant in wanting the test. If we've made those dietary changes and eliminated common triggers like dairy or gluten is another one of those, and there's still problems, then I usually go towards testing. Um, Deciding between different panels and different companies is really depends on price range that a patient has, or what labs that you have available within your own clinic. We use an array of them here, and each company always touts that they're the best. So you kind of have to do your own research and figure out which companies that you want to work with and carry within your practice.
Thank you. I'm wondering if you can speak, you mentioned briefly some breathing exercises for folks who are having respiratory issues. Can you talk a bit about yogic breathing or any breathing exercises in general and how that might help?
Absolutely. So there's many different types of breathing techniques, like box breathing, where you're like counting 4 counts, inhale, holding your breath for the same amount of counts, and then exhaling. I'm also a big fan of what's called the 4-7-8 breathing technique. So that one would be 4 counts of inhalation, holding your breath for 7 counts, and exhaling for 8 counts. Um, Breathing techniques are just a great way to give general relaxation. And sometimes when people get asthma attacks, it's very anxiety producing. So concentrating on breathing with a certain rhythm to the breathing can help relax that person for the time being.
Thank you. Yeah, I think, uh, there isn't always an anxiety component, but if you've ever had trouble breathing,
It's
it, it,
scary.
it can be scary. And so, I think that just that alone, just that recognition of helping people to calm down is really important. There are a few folks who have asked for specific dosages. Unfortunately, we're not able to give dosing requirements today. So I did just post a link to find a naturopathic doctor near you, both in the US and Canada. But we're not able, just for the safety of folks, to give any specific dosing or specific medical advice today. But that said, we can speak in generalities as we have been. Dr. Bose, would you be able to talk about eosinophils and helping to immunomodulate? And are there any things that you like to do for immunomodulation?
So immunomodulation of your all of your white blood cells really is going to come back to what we discussed earlier. So an anti-inflammatory diet or a diet that's high in whole foods and vegetables and fruits. Using anti-inflammatory natural supplements like that vitamin C, but bromelain, curcumin, quercetin, those are all going to modulate your immune system, as well as, vitamin D, fish oil, all help to modulate that immune system and make everything regular. With asthma and allergies, typically your whole immune system is just really upregulated because of the introduction of the allergens. And when we can, reduce that allergic response, that's where you're going to find the benefit.
Thank you. We've got a couple questions about essential oils. And I know with folks who have hyperreactive airways, you usually want to decrease the volatile oils in their environment. And you also have to be concerned about the quality of the essential oil as well. But I'm wondering if you can talk a little bit in generality of usage of essential oils with respiratory issues and asthma.
Right. So there are some essential oils that will help open your airways and reduce congestion. We talked about thyme within the botanical tincture, but you can also use that as an essential oil, rosemary as an essential oil. Eucalyptus and peppermint are really great for opening the airways and reducing congestion. You usually don't want to put them directly on the skin, but mix them within what's called a carrier oil. I like almond oil for that, or some like castor oil, even you can mix it within there, or coconut oil before applying it to the skin to ensure that you're not going to irritate the skin and cause a reaction.
Thank you. So you mentioned environment. So, sometimes there are things in our environment that we can't get away from. Like if there's a tree and you didn't plant the tree, so you can't cut it down, that you're allergic to. How do you help folks mitigate their environmental sensitivities if maybe there are some things that aren't in their control, like seasonal pollen and trees and grass and so forth?
Yeah, absolutely. So things I like to recommend is once you're exposed to that allergen with pollen from a tree that's outside your house, you can, when you come inside, you can, wash your mucous membranes. So, using compresses on the eyes, neti pots or nasal lavages are a great way to do that. Bringing a HEPA filter inside your house. I know it's a great time of year to sleep with your windows open, but if you have allergic responses to pollens, it's probably a better idea for you to keep your windows closed so that the pollens aren't entering your home and causing more issues. Also, washing your bedding often is going to be a way to reduce your allergen exposure.
And those are all things I'm in Southern California and everything is blooming right now. And so we've been doing all of the things, the nasal lavage, the other piece too of taking a shower before bedtime, not wearing any of your outside clothes onto your bedding. So making sure that like if you've been outside or, in the garden or, doing anything, take those clothes, put them in the washing machine. Don't go and jump into your bed with the clothes that are all full of pollen because then you'll be sleeping in the pollen. So yes, all of those things can be helpful. I think it's really tough, especially this time of year for people who, I think as things are heating up and raining more and heating up and raining more, we're definitely seeing more volatility and more allergies popping up for people symptomatically. Uh,
Mhm.
so I'm wondering, in addition to some of those environmental factors, what types of exercises may be helpful for folks? Movement, if they are having trouble getting outside, is there anything that you recommend for people?
I'm a big proponent for exercising at home. That's where I get most of my exercise. There's plenty of YouTube videos that can help you through an exercise program. You can easily do yoga at home or meditation. Um, that's what I like. I like high intensity interval training myself, but I always say to find something that you enjoy doing. Um, you can go to a gym as well. Usually, it's, you know, they're not going to have, let's hope it's a good facility at least. But you also don't have to have a gym membership to be able to exercise.
I think that's a really important point. Oftentimes people think, oh, I've got to, I have to go to a gym. I have to buy really expensive equipment. And, a quick YouTube search or a Google search will find a lot of exercise videos. I think for some people, it might be the motivation uh, as well. So sometimes having a partner or, an exercise buddy, the buddy system of having somebody who can help keep your accountability factor going, because for some
Absolutely.
people they have the motivation to do it on their own. I've also seen, which is really helpful for some folks, especially as we've been so sedentary in this past year. There's something called exercise coupling, where a lot of people think, oh, I've got to exercise for an hour a day, I don't have a whole hour. But you can couple exercise, short brief exercises, to things that you do every day, like brushing your teeth. And so one person I saw, um, spoke with recently, squats 5 times every time she brushes her teeth. And so it's like little things. Or when you go and go to your kitchen sink, does a couple push-ups on the kitchen sink. Like, there are just little things that you can, again, it's what's going to work for you. But exercise coupling for some people will help, just because it ties it to something else. And so even as you're running through your day, you're getting a little bit of movement in your body. So
Right, and expanding upon that, I think a lot of people do have that misconception that you have to exercise for an hour at a time. I think that I read an article recently that was showing that you can get all the cardiovascular benefits from just 12 minutes of exercise a day. So
of good exercise.
good exercise, right?
Yes, good and safe exercise. So there are a couple of questions. I'm not sure if folks came in late who are asking about uh, types of medicine and things in asthma, but we did cover that earlier. So we will have a recording of this that you can play later on in the week, uh, if you've missed a little bit of what we've already covered today. And let's see. Um, so can you go through a little bit of the role of B vitamins, and just in general, how people can ascertain if they're needing to see an ND, and what types of things they should be doing for overall health.
Right. So B12, a lot of times people will have fatigue if their B12 is low. If you're eating a vegan diet and or vegetarian diet, it's more likely that you could have B12 deficiency. Or if you have conditions where your gastrointestinal absorption isn't where it needs to be, you could have B12 deficiency. Um, Foods that you can get this from are red meat, of course, but really any kind of meat, fish, and chicken, lamb, if you like to go that route. Some of our darker leafy greens will still have some B12, just in smaller amounts, or you can supplement with it. There's also B12 injections where they can take B12 and inject it into your body without having it go through the gastrointestinal system, in case if you're unable to absorb B12, you can still get that benefit.
Excellent. So I guess just a personal question. What is your most favorite thing about being a naturopathic physician?
My favorite thing is working with patients and with their lifestyle factors to get them on a path of healing. A lot of times, patients will have already seen their medical doctor and are just looking for something more instead of, just the medication or trying to get to the root cause. So I like kind of being that detective and investigating their health history, seeing ways that they can improve overall to make them healthier, and then using natural substances to speed up the process. Every case is different. So, every day you're working with a different patient, or, sometimes they have trouble. Sometimes people are able to implement everything right away, and that's great. And then other times people need more help and guidance. So it really depends on the person. And I love just working with each individual to make their lives healthier and give them the things that they need to be able to become healthier.
Wonderful. So are there any parting words that you would like to leave our guests with today?
I just want to thank you all for attending, and I'm very excited to speak on this topic with all of you. And if you're interested or want to know more about me or how I got to where I am, you can always reach me at any of these contacts, and I'd be more than happy to speak with you either on Zoom, the phone, if you ever wanted to observe within our clinics as well. That is also an option.
Wonderful. Well, thank you so very much for spending time with us today. I appreciate your time. I know that Dr. Bose has already seen patients today, and she has to go back to her patient care. So we will be wrapping up now. But thank you so very much for spending time with us today, and Dr. Bose for all of this wonderful information. And so with that, we're going to close up our webinar. We hope to see you at another AANMC event in the near future. Thank you so much.
Bye.